Communicable diseases: tuberculosis, HIV/AIDS, and malaria. Together, these three conditions account for about 3.4 million deaths in 2010, 1.7 million from HIV, about 1 million from TB, and at least 700,000 from malaria. Each has been a major target for global action, including billions of dollars being spent by the Global Fund for AIDS, TB, and Malaria, which was formed around 2002 to combat these specific deadly diseases. Each disease differs in its epidemiology, so let's consider each separately. We'll focus on how many new cases occur, which is called incidence, and how many it kills, or the mortality. Tuberculosis. Tuberculosis, or TB, is a contagious and airborne disease caused by a stubborn type of bacteria called Mycobacterium tuberculosis. Almost all of the TB deaths in the world occur in the developing world, and these are highest in the African countries. Among the 1 million people who died from tuberculosis in 2010, 75% were before age 70 years. In fact, TB mainly targets people aged 15 to 64 years. HIV patients are 15 times more likely to develop TB due to their weakened immune system and are also more susceptible to the contagious airborne TB bacteria. In particular, countries in Africa see the highest association between TB and HIV patients. The Africa region alone accounts for almost 80% of HIV-positive TB cases worldwide. Overall, tuberculosis causes about a quarter of deaths among those living with HIV worldwide. The core strategy to control tuberculosis involves early detection of new tuberculosis cases and getting them treated quickly so that they don't die and that they don't infect others. This is called the Directly Observed Treatment Short Course, or DOTS strategy, and is recommended by the World Health Organization for all countries. Are we making progress against tuberculosis? Yes, but unevenly. Globally, mortality rates from TB before age 70 years have fallen by 40% since 2000. There was a reported increase in HIV deaths from about 2000 to 2005, and as HIV rose, so did tuberculosis deaths. But since then, there have been both declines in HIV deaths and in tuberculosis deaths. However, the progress is quite uneven. The slowest decline has been in Africa, mostly due to coexisting HIV infection, but also to poor health systems that are unable to deliver the drugs, poor surveillance, and problems reaching the poorest, high-risk, low socioeconomic groups. By contrast, well-organized TB programs led to huge reductions in tuberculosis deaths in China and Cambodia. In 2011, a little under 6 million new cases were reported by the national TB programs to WHO, and roughly 86% of these were reported to be successfully treated. If the world could achieve what we commonly have in Canada, which is any new TB patient is successfully treated, or most TB patients are successfully treated, TB could be substantially reduced as a major cause of death worldwide. HIV/AIDS. In and around 1980, there was a strange outbreak of unusual infections and unusual cancers among young men in San Francisco and New York. This later heralded the onset of HIV, which later was found as a retrovirus that caused these unusual diseases. By the mid-1980s, it became clear that many parts of Africa were facing a huge, unprecedented epidemic, with HIV infection rates rapidly exceeding 30% in many countries, particularly in southern and eastern Africa. In 2011, the United Nations estimated that over 34 million persons were living with HIV infection, as compared to 29 million in 2001. 2.5 million people were newly infected in 2000 as compared to 3.2 million in 2001. Of these new infections, 2/3 occurred in sub-Saharan Africa. Sub-Saharan Africa continues to be the most affected continent, followed by Eastern Europe and the Caribbean. Note a particularly high prevalence in Southern Africa, where HIV infection has become hyperendemic. Among adults aged 15 to 49 years, the prevalence is up to 31% in Swaziland, 25% in Botswana, and 17% in South Africa. Indeed, in Swaziland, the prevalence among women between ages 30 to 34 is an astonishing 54%. Not everyone is at equal risk of acquiring HIV. Female sex workers, men who have sex with men, and those that inject drugs are the highest risk populations. And then some occupations, such as truck drivers and fishermen, and military personnel are particularly at risk. And the good news is that since 2005, HIV deaths have started to fall, both due to fewer new infections from scaled-up prevention efforts and safer sex, but also from treatment using life-prolonging antiviral drugs. In 2010, 1.7 million people died of HIV, which was down by 26% from 2005, when the number of AIDS deaths had peaked at around 2.3 million. Similarly, the number of new infections among neonates and infants that is a result of transmission from their mothers during the time of delivery fell substantially from about 600,000 in 2003 to 300,000 by 2011. This decline was a result of simple drugs that prevent mother-to-child transmission and prevent new infections in children.